so now. And let's go to the next slide. So during today's presentation, we're going to ask that you please keep your devices muted. During the Q&A session toward the end, you will be able to unmute yourselves to ask questions and enter into the discussion. But we also encourage you to use the chat function today to submit questions and any comments. And we also have a closed caption function that you'll find at the bottom of your screen. Next slide, please. For those of you who are new to this series, Trust for America's Health, or TIFA, as we call ourselves, we are a policy, research, and advocacy nonprofit dedicated to optimal health and well-being for every individual and community. Our AFPHS training series is part of our initiative to elevate healthy aging as a core public health function, and is designed to increase the capacity and expertise of the public health and aging services community on the public health roles in healthy aging. This year, our AFPHS trainings are focused on the social determinants of health, and we're pleased to welcome 3 experts today who will address food security nutrition among older adults. Next slide. The United States Department of Agriculture, USDA, defines hunger as a potential consequence of food insecurity that, because of prolonged involuntary lack of food, results in discomfort, illness, weakness, or pain that goes beyond that usual uneasy feeling. These conditions can lead to negative health impacts, as well as increasing medical care costs. Now, we're going to learn a lot more today about these challenges from our speakers, who I will introduce in just a moment. But it's clear that public health definitely has a role to play to help mitigate the effects and the outcomes of hunger and food insecurity, and to improve access to food, to nutritious food and food services. So next slide. And I will introduce our speakers. First, we'll hear from Alex Ashbrook, Director of Root Causes in Specific Populations at FRAC, the Food Research and Action Center. And then we'll hear from Uche Okubundu, Senior Director, Nutrition and Strategy Impact at Meals on Wheels America. And then Jen Jordan, Senior Community Health Nurse at the Florida Department of Health in Walton County. And Walton is one of our star county health departments in Florida, becoming an age-friendly public health system and an age-friendly community through AARP. So really happy to have Walton participate in our session today. So I'm going to turn that over now to Alex, and we look forward to all 3 of your expert presentations.
Hi, thanks so much. I'm delighted to be here. So just a quick word on FRAC. We work to end hunger in the US and thereby improve the nutrition, health, and well-being of people who are struggling against poverty-related hunger. And for your purposes, there are just a few things I wanted to highlight about FRAC that may come in handy. First is we have a network of anti-hunger partners in every state. Their names and information are available on our website, or you can reach out to me and I can connect you. We have lots of resources on older adults and ways to address hunger among older adults. And we also are going to be launching an online course for CME credit, which is for healthcare professionals, on how to address food insecurity among older adults by screening and intervening. So I hope encourage you to look back on at the FRAC website at some point. Next slide, please. So food insecurity is the limited or uncertain availability of nutritionally adequate and safe food. And unfortunately, millions of older adults struggle with food insecurity. There are about 47.6 million households with an older adult age 60 or above, and 8.2% of those households struggle with food insecurity. Now, that's slightly lower than the national average of 10.5%, but we'll talk a little bit more about who is at risk of experiencing food insecurity among the older adult population. As you can tell by this NAT, there's no geographic community that is immune from food insecurity among older adults. And Washington, D.C. at 15% has the highest rate of food insecurity, and the lowest rate is at North Dakota at 3.2%. And if you click on that link, you can be connected to your state food insecurity rates. Now, some older adults are disproportionately affected by higher rates of food insecurity. Next slide, please. So as this slide illustrates, long before COVID-19, food insecurity rates were disproportionately harmed Black and Latinx households with older adults compared to white households. And during COVID-19, the inequitable rates of food insecurity for Black households with older adults were further exacerbated. And you can see the gaps between Latino and white households remained fairly consistent during COVID. So if you look at 2020, Black households with older adults reported the highest rate of food insecurity at 20.7%, while white households with older adults reported the lowest rate at 5.1%. Now, these disproportionate rates of food insecurity are driven by underlying structural discrimination and other systems of oppression. So it's really important to make sure that we don't lose sight of the need to address these inequities as we work to address food insecurity and improve health. Next slide. There are also certain groups of older adults that are more at risk of food insecurity based on socioeconomic factors like being economically disadvantaged, being separated, divorced, or never married, having children or grandchildren in the household, or living with a disability. And of course, people's identities intersect with a lot of these factors, as well as some of the race and ethnicity factors that we showed in the slide before. Next slide, please. So I know you all are well aware of how food insecurity harms the health of older adults. I just wanted to talk a little bit about some of the things that help fuel the poor health outcomes of food insecure older adults. Some of the challenges older adults face are they may run out of food. They may skip meals, and often people skip meals so that others in the household can eat, such as grandchildren. Sometimes people are forced to choose between paying for medical care or prescriptions or food. And that's so prevalent that it's been deemed the eat or treat dilemma. We've also have lots of research on how food insecure older adults may postpone medical care. And the interplay of these factors can lead to poor health outcomes. Food insecurity is associated with a range of chronic diseases, including hypertension and diabetes. And when you add all these things up, these factors drive higher healthcare costs. FRAC has a piece in our Hunger and Health series that really spells out the research on food insecurity and its health implications. Next slide, please. So what can we do to support the older adults we work with who are struggling with food insecurity? Well, fortunately, there are a range of programs that benefit older adults, and the key programs are available to older adults 60 plus are administered in two separate federal agencies, the USDA and the HHS. And it's important that we work to bust silos so that older adults can connect to all the programs they're eligible for. Next slide. So I'm going to zero in on the Supplemental Nutrition Assistance Program, SNAP, and my colleagues will be sharing information on some of the other programs. But SNAP is a great help for older adults. It provides them money to purchase food, and the money's loaded on an electronic benefit transfer card, which you may see on the checkout line in the grocery store EBT card. It looks just like a debit card, and it's accepted at tens of thousands of grocery stores, farmers market, and other food retailers across the country. And what's unique about SNAP is that it's the only nutrition program available to all eligible older adults in every part of the country without the need for additional federal appropriations or subject to wait list. So it can grow when there's an economic crisis, or when there's a weather-related crisis, or when a family has a crisis. People can access the program. It's set up to expand during times of need. As reflected in this slide, there's a considerable body of evidence that shows how SNAP plays such an important role in improving food insecurity, economic security, health, and diets of older adults by helping them afford to put food on the table. And SNAP is especially tailored for older adults. There's special rules. There's no gross income test. In most states, there's no asset test. There's a streamlined application procedure. There's streamlined application procedures. Older adults can deduct out-of-pocket medical expenses and all their housing costs, and that can actually help them get a higher benefit level if they take all those deductions. And they also can use an authorized representative in the event that they're not able to go to the office and complete paperwork, although more and more paperwork's done online or over the phone. Or they can also give someone permission to use their card to shop if they're unable to get to a grocery store or other retail outlet. Next slide, please. So SNAP is helping 5 million households with older adults on average each month. So it's the program that has the farthest reach. Yet, and participation has been growing for older adults over the last few years, thanks to concerted efforts by a lot of amazing stakeholders who are doing more and more to connect older adults to SNAP. But even so, only 48% of all eligible older adults are participating in SNAP. Whereas if you look at the top line, participation rates for all eligible individuals are at 80%. So we have a ways to go in getting more older adults to participate in SNAP. And this graph gives you a sense of how there's some older adults who are participating at higher levels. Those receiving Social Security, those living alone, and those not living alone. Next slide, please. So a word on how SNAP was responded during the public health emergency, and a warning about how this response is going to be tapering off across the country. It already has in some states. But during the public health emergency, Congress passed legislation to basically give everyone higher SNAP benefits. And a very dramatic way this helped an older adult was an older adult who prior to the pandemic was getting the minimum benefit of about $18 a month, was suddenly eligible to get more than $200 a month in SNAP benefits. So their benefits went up, almost $200. Others were up to the maximum SNAP benefit level for their household size for the first year. And then when the Biden administration took over, they realized that there was room to give people who are already at the maximum level additional benefits. So families who got about $80 extra per month. So this is going to expire when the public health emergency expires at the national level. It's already expired in some states who have not taken advantage of these increased benefits, but we're really expecting a deep SNAP cliff when the public health emergency expires. And that is not coming at a good time, as you all know, because food prices have gone up and there's still a desperate need for more assistance to purchase food. So just to put this in context, for the states that haven't had the public health emergency end, people are going to be losing about $82 a month per person in SNAP benefits. So food banks and other programs, Meals on Wheels, congregate meals, are going to have a really, really tough time responding to the increased need. Next slide. I wanted to underscore how important increasing SNAP benefits has been during the pandemic. FRAC, with funding from AARP, did a report talking to older adults about how the benefits help them. And this is just one of many ways the benefits help them. It helped people enjoy freedom It was a real positive, uplifting experience, made me feel better about myself. And that was during COVID. It was a huge, huge resource to folks. Next slide, please. That's the report if you're interested in reading it. And next slide. And then the one after that, this is a repeat slide. Oh, no, I'm sorry, go back. It looks like a former slide. So here are some things that we need folks to do to help older adults as the public health emergency ends. One is to make sure that folks are taking the deductions, the allowable deductions that are going to maximize their SNAP benefits. So a lot of older adults may not be taking out-of-pocket medical expense deductions. So making sure all their deductions are reported to the state agency is really important. There are also some advocacy efforts around the country where they're trying to get states to invest in putting funds for a higher SNAP benefit. And we're also encouraging USDA to keep implementing waivers that have made it easier for people to apply from the safety of their home. Next slide, please. Long term, the most important thing we can do to improve the SNAP program, which is already an incredible program, is to make sure the SNAP benefit is adequate and everyone who needs the program can access it. And this is a really interesting report that USDA put out on how the Thrifty Food Plan was inadequate. It was based on outdated modes of cooking and purchasing food. So the Thrifty Food Plan was increased. SNAP benefits went up, but they only went up about $30 per person a month. So they haven't caught up with what a person needs to be able to purchase healthy food throughout the entire month. Next slide. So here are some strategies. There's the Farm Bill is up and coming, and there are lots of actions anti-hunger advocates, health advocates, and others are taking to try and strengthen the Farm Bill. So in preparation for the Farm Bill, there are a lot of great marker bills out there. One is the Elma Adams bill, which is the one that's called Closing the Meal Gap. Has some really important components, including things that would disproportionately help older adults, like increasing the minimum benefit, having a standard medical deduction, increasing the SNAP benefit to be connected to a higher, more adequate food plan called the low-cost food plan. And then there are things you can do at the state level. For instance, encourage your state to adopt the restaurant meals program, where older adults and people with disabilities and homeless people can access SNAP at participating restaurants. Combined applications are a great way to help more older adults access SNAP by making it easier to apply for SNAP and Medicaid, or SNAP and SSI, or Social Security. States can come up with their own standard medical deductions. And there are also a whole host of things in the Elderly Simplified Application Project to make it easier for older adults to access SNAP, like making the applications shorter and having a longer certification period. So these are all great strategies to help connect older adults to a critical resource to address food insecurity, improve their nutrition, health, and well-being. Next slide. So in closing, an older adult who is part of our recent research piece was asked if they would recommend SNAP to a friend. And this is what she said. Yes, I would recommend SNAP because it's a great program and it's here to help us. I've referred people to get help because this is a worthy and worthwhile program, especially for seniors and kids. Thanks. I look forward to answering your questions at the end. And now I will turn it over to Uche.
Great. Thank you, Alex. Uche, take it away.
Sure. Thanks so much. It's such a pleasure to be here this afternoon. Hello, and I'm Uche again. I work at Meals on Wheels America, leading our nutrition strategy. And before I get started with this portion of the presentation, I'd love to orient folks to what Meals on Wheels is. So we are a national network of over 5,000 individual programs, a network of local community-based senior nutrition programs, all dedicated to addressing the social isolation and hunger. So we are in virtually every community across the country, and along with 2 million staff and volunteers, we deliver nutritious meals, offer friendly visits, and safety checks that help seniors across the country live nourished lives with independence and dignity. These organizations are staffed by seasoned, dedicated aging and nutrition service professionals with skills in food service, social service provision, and many have deep connections across the social services infrastructure in their local communities. At the national level, we leverage funding, education, research, advocacy support to provide these local providers doing this good work around the country to empower them, strengthen them, and make sure they are best positioned to serve and support older adults in their local communities. You can learn more online at mealsonwheelsamerica.org. All right, with that grounding, let's move to the next slide. Thank you, Alex, so much for the great introduction you provided to food insecurity and the challenges in older adults. I will be focusing a lot more on the experience of individuals who are served by the Meals on Wheels network around the country. This includes individuals who are homebound, unable to leave their homes, as well as seniors who are more ambulatory, but seeking community dining opportunities at the congregate meal sites. So in the before times, before the COVID-19 public health pandemic, food insecurity and malnutrition were already prevalent and detrimental in the older adult population. And the pandemic for sure exacerbated these effects. While no one was touched, the pandemic had particularly an adverse impact on older adults, many of whom, as Alex aptly noted, were at high risk for not only contracting the virus, but some of the concomitant effects of food insecurity based on systemic factors. Older adults, particularly those with limited physical ability, had to quickly navigate to figure out new ways of engaging with their food access environment to address stay-at-home orders, navigate job or transportation loss or other disruptions in order to continue to secure the resources they needed. So before, 1 in 4 seniors lived alone, 1 in 10 experienced poverty, and nearly 1 in 3 lived with a disability, all while experiencing challenges with regards to social isolation and loneliness, and as Alex mentioned, the threat of hunger. Next slide, please. Then along came COVID, and as a result, we saw a disproportionate number of seniors who indicated to us that they did not have sufficient amounts to eat. There was a 75% increase in this figure, as noted on this slide, and to Alex's point, disproportionate impact of this challenge depending on seniors' race and ethnicity. At the highest point in the pandemic, we saw that programs reported delivering 100% more home delivered meals weekly than they had before the pandemic. And even last year, we see that that number has gone down some to 57% more, but still increased levels. So Meals on Wheels programs are on the front lines every day, doing all that they can to keep older Americans safe and nourished. And it's particularly challenging at this time, but there's so much opportunity to leverage lessons from the COVID-19 experience. Next slide, please. During the height of the COVID-19 pandemic, there were important programmatic pivots that were necessary to ensure that programs could shift to address the needs in the community at the time. So on the slide here is just a quick synopsis of some of these pivots that were made. Programs around the country indicated that they changed the services that they were providing, reworked some of their service offerings or operations in terms of logistics, how food was delivered safely to folks in the community. They tapped into local partnerships in order to fill the gap, connect with different providers, new and non-traditional providers, to ensure that they could provide emergency meals and other services to seniors. They also provided congregate or community dining in different formats. Almost half of the programs noted that they were serving seniors in drive-through or pickup meals, as opposed to the inside community dining type approach in the before times. And lastly, of course, they really focused on developing and strengthening social connection programs. More than half indicated that at least some of the clients were developing and reporting social isolation and loss of connection. And so programs around the country really focus on how to strengthen these virtually, in outdoor settings, in all kinds of ways, by mail, all kinds of ways to make sure that seniors could feel connected and have access to the resources and programming that they really needed. Next slide, please. So during that time, we particularly focused on how to take hold and understand the impact of COVID on older adults. During this time, Meals on Wheels America commissioned a strategic research portfolio comprised of a national COVID-19 study and a particular study looking at older adults. We also surveyed our members during this time and have since been continuing to issue pulse surveys of our network to really understand where they are and how the situation is evolving. You're welcome to visit us online at this web address here to learn more about our COVID-19 portfolio of research. So late in 2020, we engaged NORC at the University of Chicago to conduct a study on behalf of Meals on Wheels America, leveraging a nationally representative population to really explore how COVID had affected older adults 60 plus in age, how they felt services could evolve, and how we, as well as a national network, could align ourselves with the changing needs of older adults. At the highest point in the pandemic, we know that Meals on Wheels programs around the country reported delivering an average, as noted, more than 100% home delivered meals. Many continue to face challenges such as rising food prices, rising gas prices, supply chain challenges, hiring and retaining enough staff and volunteers, recruiting and retaining, onboarding volunteers continues to be a challenge as well. Next slide, please. So ultimately, and happily, at the federal level, through the different legislations that were put into place during this time, we saw a responsive and effective set of policies that helped address the evolving public health emergency. As Alex mentioned, there were increases in eligibility and enrollment for Meals on Wheels and other aging services like SNAP. We saw a decrease in administrative burden in terms of how programs needed to report or submit documentation about the program to their federal partners. This resulted, again, to Alex's point, in an increase in buying power and an opportunity to gain access to more food and nutrition resources for seniors, really important during this critical time. There were also targeted flows of resources from the federal, state, and local levels to community-based providers, and designations for folks in aging services as essential workers that allowed them to gain access to needed resources and target the community in new and important ways. All this also created an environment where programs at the local level were able to and encouraged to be inventive and be flexible and try new things, try different ways of reaching out and connecting to seniors locally so that all who could be served were served. Next slide, please. So for Meals on Wheels services locally, it often looks like a different array of services that seniors can access. Many are familiar with the truck and the meals driven from meal sites to seniors. Many may not know that senior Meals on Wheels programs locally also offer this range of services, providing pet services to make sure that pets are also taken care of. That way seniors are not leveraging their meals and their nutrition and well-being for the pets in their homes that provide much needed social support and companionship. Volunteers are engaged in various ways to support programming. These volunteers and others, health professionals, for instance, or public health workers, can also provide social visits, wellness checks to the home to ensure that seniors are safe and secure in their homes of choice. We also provide safety checks during these visits. So Volunteers can cast their eyes at the homes of seniors to make sure that any hazards are looked at and addressed. Clearly, there are meals offered. And lastly, in some communities, seniors are able to access home repair services as well, so that their homes, if there are any hazards identified, those are addressed in a timely fashion through referrals to the local community. So this is definitely a meals plus more approach, because we know it is certainly more than meals that allow seniors to remain nourished and healthy in their communities of choice. Next slide, please. All right, so I wanted to take a moment to pause and put this back into the context of social determinants of health. This is a diagram that many are familiar with. I would like to take a moment to pause and focus on the light, one of the light blue sections, which is the food aspect. And on this diagram, we talk about food insecurity, which is the main part of our conversation today, in addition to access to healthy options. Through Alex's presentation, SNAP is an excellent way to access healthy options, as well as the aging services programs like Meals on Wheels programs in the community. But for a moment, I wanted to focus a little bit more closely. If you would just advance the slide just a little bit, I think there's additional text that will show up. Excellent. It's small text, but I wanted to leave this here for posterity. In this food section of the social determinants of health array, there's so much more to consider. I would love for us to be able to add to this section by making sure that we're considering the age appropriateness of food interventions that are offered to seniors, their medical alignment with the needs of the seniors, how linguistically available are these services across communities? Are they culturally appropriate? Are they also appropriate for the functional status of older adults? Many do range. And so looking at food insecurity and access, it's so important to remember that for older folks, there is another layer of consideration often that we need to bring to bear to ensure that not only are these services, again, age, medically, linguistically, culturally, functionally appropriate for them, but they're offered in respectful ways for older adults to access. So in that food category includes meals, of course, groceries. We also want to consider the impact of nutrition education, counseling, and in some older adults may need nutrition supplementation to ensure they're meeting their dietary requirements. And so I wanted to take a moment to really take the food component of social determinants and add a little bit more color as is appropriate for older adults. And these are the kinds of services that through programs administered from the USDA and the Department of Health and Human Services, we are able to connect seniors in this specific way that seniors need to the food and nutrition services that support their health. Next slide, please. And so I will just take this last few minutes to share some brief examples from the field in terms of how inventive practices are ongoing in the COVID era and going forward. In one instance, we have seen a lot of restaurant partnerships have occurred between Meals on Wheels programs and local food retailers. One example is in Meals on Wheels Orange County, where they expanded a program set forward in 2020 by the governor there, looking at how to connect the food industry with Meals on Wheels. So this Great Plates Delivered initiative was born, and the Meals on Wheels Orange County leveraged this into senior cuisine delivered and connected seniors with affordable meals that were tailored to a diverse array of ethnic and cultural tastes. You can learn more by visiting the URL on this slide. On the next slide, we can see yet another example of an emergency services partnership. At our program in Columbus, Ohio, Life Care Alliance, they have, through innovation funding, been able to focus on community paramedicine and understand the relationship between Meals on Wheels and the use of emergency services. How can these programs come together and reduce the cost of healthcare and ensure that aging services can support community emergency medicine services and taking advantage of collaboration to provide greater efficiency. Next slide, please. There are healthcare partnerships ongoing around the country. One such example is a post-discharge benefit meal offered by Meals on Wheels Albuquerque. This particular program is interesting. It is embedded in a hospital. It has spaces within the hospital, so it is better able to connect with Presbyterian healthcare services in Albuquerque and provide service to Medicaid and Medicare eligible seniors by making sure that they have access to a post-hospital discharge benefit, a set of 20 meals that they can leverage to help support their health after a healthcare stay. These meals are tailored to the local taste of seniors as well. Next slide, please. Lastly here, this is an example of a cross-sector partnership put forward by our member program, Age Options. They have received innovation funding to be able to evaluate a gap in the array of senior services provided by home delivered and congregate meals. The unique focus of this grant is to target unmet needs through alternative food distribution processes, work with unique cross-sector partners that provide food to specific demographic populations, a major food retailer, to ensure that ethnic and racially diverse older adults have access to the kinds of foods that they need to address food waste, as well as the evolving tastes of older adults. Next slide, please. And so COVID-19 has presented challenges to the network, but so much opportunity as well. So many programs are looking at this as an opportunity to not only return and reopen in the ways that they had before, but reinvent, reimagine the array of services they provide, tackle unmet needs, reach out to new populations of older adults, rebuild or build new partnerships in the community, and reach out anew to older adults who may not have reached they have been reaching before, but have been surfaced and now are clients as a result of COVID-19 public health pandemic. Next slide, please. And so the road ahead presents us, again, opportunities and challenges. We know that the population of older adults is growing. We know that this population is also evolving in terms of their needs for nutrition services. We are here as a national network to provide service to them and make sure that we can connect them through partnerships with public health departments and others to the resources that they need. And in closing on my last slide, next slide, please. Would just like to reiterate this point that ultimately it's important that we're providing responsive and client-centered partnerships informed by research and practice to meet the needs of older adults. And we can certainly do that more so with partnership across multiple sectors. Thank you so much for your time, and I'll turn things over to our next presenter.
Great, thank you so much, Uche. Some really great information. I already have some questions formulating in my head, so hopefully there'll be enough time for us all to ask our questions. So now we'll turn to Jennifer Jordan from Walton County, Florida. Jennifer.
Perfect. Good afternoon, everybody. So first off, just thank you again so much to Karan and Megan for having me here today, and also to Alex and Uche, who have done a wonderful job with presenting such valuable information. So as Megan said, my name is Jennifer Jordan. I am a community health nurse at the Florida Department of Health in Walton County, and my focus is primarily on chronic disease prevention and community education. So I'm going to speak to you guys today about some of the things that we've done here at our local health department to help bridge the gap when it comes to promoting good nutrition and combating food insecurities with our older adult population. Next slide, please. All right. And I'm trying to get mine to cooperate on my side as well. So bear with me, technical difficulties. All right, so to kick things off, I've got a few statistics that I want to share with you about our county. As of the 2020 census, we had about 80,000 people living in Walton County. But as you can see from that really big number there at the bottom, we had over 5 million visitors in 2020. So we are a very tourist-driven area with our beautiful beaches of South Walton and 30A. So that 80,000 population number is kind of a bit skewed. food. From 2020 to 2021, we actually saw a 6.3% increase in our population, and a little over 20% of our 80,000 population is over the age of 65. With that being said, let's kind of go back to that 5 million number and just keep in mind that a large percentage of our visitors that we have here are what we lovingly refer to as our snowbirds. So that's our older adults that typically come from up north and stay during the fall and winter months. And more lately, they are staying longer and longer. So, anywhere from 3 months to 6 months and maybe even longer. So, as you can see, the numbers can be a little bit deceptive there. And if we took 20% of our normal 80,000 population plus our visiting population, that means we've got roughly 1.1 million adults over the age of 65 in our county in the year 2020. And that's fairly significant considering that there was a report released in May by Feeding America that claimed 5.2 million seniors were food insecure in 2020. And we've got 1 million of them right here in our county. So that's pretty significant. All right, next slide, please. So what are we doing about it? Let's see. And I think I actually reversed my slides. So I'm going to have, if you don't mind, I'm going to go one forward and then we'll go one backwards just to mess us up a little bit and keep these interesting, make sure everybody's paying attention. So for starters, in May 2019, Walton County became part of the AARP network of age-friendly states and communities and the World Health Organization's global network of age-friendly cities and communities. Through our FQHC, which is a federally qualified health center, our CHIP group, and our age-friendly recognition, we have begun work on numerous initiatives. First of all, we are one of only 2 health departments in the entire state of Florida with the designation as an FQHC. So that means not only do we focus on public health here, but we also provide primary health care services to patients. Last year, we saw roughly 250 patients that were age 65 and over, which was about 5.5% of our clientele. And our providers here do a fantastic job of providing frequent ongoing education to our clients when it comes to good nutrition practices. All right, so now if we'll go back a slide. Thank you so much. All right, so each county health department has what's called a CHIP group. Ours is called WCHIP, the Walton Community Health Improvement Partnership. And under our CHIP umbrella, we have several different work groups. I'm actually the facilitator for our Healthy Places work group, which encompasses a few different initiatives. As you can see there, we've got Healthy Walton Parks, Faith, Work Sites, and we recently added Gardens into the mix. Earlier, you heard Alex speak a little bit about SNAP, and one of the branches off of SNAP is SNAP Ed, and that's an educational program for those receiving SNAP benefits. So I'm the coordinator and educator for that program here in Walton County, as well as our Healthiest Weight program, where we focus on policy changes that also help support nutrition and physical activity. All right, and then if you'll advance for me, please. Perfect. All right, so the Walton Community Health Improvement Partnership, or WCHIP, is a dedicated group of people from a variety of agencies, organizations, businesses, and community members who want to make a difference in the health of Walton County's residents. Through WCHIP and our Healthy Walton series, we have partnered with different agencies such as our local extension office and the Master Gardeners, our area food pantries, the United Way, our local senior centers, farmers markets, and community parks. So our Healthy Walton Parks initiative actually began in 2020, and one of the primary community activities to support our goal is that it's a multi-generational park, meaning parks that are designed for all ages and abilities. We completed assessments of all of our parks in our county, and in 2021, we were able to award our first 4 parks with the Multi-Generational Park Award. But 2 of the key criteria to obtain this award are that the park must be age-friendly, but they also must have a dedicated green space for gardens. And our hope with that is that by including these requirements, we can actually create a movement to bring fresh, healthy food into public spaces and encourage some of our older adults to participate in creating and maintaining these community gardens. We are also working on some initiatives within our work sites and also with our faith-based organizations to incorporate more nutrition-based education and information. Next slide, please. All right, so in an effort to reduce obesity in adults and families, we have partnered with key community partners statewide to implement our SNAP Ed program. SNAP-Ed stands for the Supplemental Nutrition Assistance Program Education. So one of the educational series that we have taught over the last year here in Walton County is called My Plate for My Family. It's a USDA approved curriculum that teaches families how to plan and shop for and prepare healthy meals on a budget while using their SNAP benefits. Back in February of this year, I actually did this series for an older adult population at a local library, and we were able to adapt the curriculum more towards them. We did a 4-week series with some hands-on meal planning activities. We discussed the importance of good nutrition. We broke down food labels. They learned how to stretch their dollars while still preparing some healthy, well-balanced meals. And we found that many of the older adults in our community are also taking on the role lately as primary caregiver for grandchildren. So, you know, having a family-based curriculum that also incorporates tips on how to shop and cook for younger children was also incredibly helpful for them. And one of the favorite activities that they did was we scanned the sales flyers, and they had a homework assignment to come up with a nutritious meal that could feed a family of 4 for under $15. And then we actually went and shopped for those items and prepared that meal in the class and got to try it. And just in case you're wondering, they settled on a turkey and bean chili, so packed full of protein. They had a chopped salad on the side, so we got some veggies in there. We also strongly rely on our community partners. So one of our key partners is the Council on Aging, as well as our senior centers. And we've worked with them at several different community events to distribute vouchers through the Senior Farmers Market Nutrition Program, which is a branch off of SNAP. We've also teamed up with some of our local farmers to bring pop-up farmers markets directly here to our health department, so that as our patients are coming through for appointments, or if they need to, you know, come in to talk to somebody, our farmers are already here. And if they have their SNAP vouchers or their SNAP benefits, they can actually go right outside to the market and get some fresh produce. And then through our Healthiest Weight Florida program, we're currently working on a PACE-EH project. So a PACE-EH project is Protocol for Assessing Community Excellence in Environmental Health. That's a mouthful. But basically what we're doing with our project is we are further promoting our community gardens and green spaces. So the city of Freeport here in Walton County has partnered with us, and they, as the first step, they recently put in blueberry bushes all throughout one of the parks in the city of Freeport, so that visitors could have, you know, a quick healthy snack on the go. But they're also currently building a new barrier-free park in the city, and they have plans to include a green space there as well. And we already have some seniors that have mentioned that they might be interested in helping with maintaining that garden. And then finally, kind of one of my pet projects, we recently placed several raised beds at our main office in Defuniak Springs, and we'll soon be expanding that to our coastal branch in South Walton. So here currently at our office, we have tomatoes, squash, zucchini, carrots, radishes, peppers, pole beans, and corn growing in our garden. And not only it is a great activity, you know, for our staff to just kind of get outside and do something hands-on and kind of de-stress a little bit, but we are giving back the produce that we harvest to the community. So we have a little food pantry that we established through a partnership with the United Way. And, you know, typically your food pantry has a lot of non-perishables, but we wanted to kind of one-up that a little bit and have some fresh fruits and vegetables as well. So anything that we grow is going back into that food pantry, which we're really excited about. All right, next slide, please. Okay, so our next steps, obviously, we want to continue with the current initiatives that we're working on, but our current next step here in our county is our community health survey. So every 3 years, our CHIP group actually conducts a community health survey, which kind of brings it back to that social determinants of health, and it helps us just to find out what we need in order to make our county healthier. It allows us to develop a deeper understanding of some of the issues that relate to our citizens' thoughts on quality of life, availability of services, and physical and mental health. And one of the key topics in this community health survey is food insecurity. So, you know, with the feedback that we receive from the community, we take that information, and that will help us expand on services and education to help address those specific needs in our community. Okay, next slide. So I know that was a lot of information. Trying to get through it kind of quickly so that we have some time for some Q&A. But if you do have any additional questions or comments that we're not able to get to today about anything I discussed, or if you have any feedback on some of the initiatives that we're doing and ways that we can improve, please feel free to reach out to us. There's my contact information, and then Ryan Mims is our Chief Health Strategist and also our WCHIP coordinator. So we would love to hear from you guys. And that wraps me up. Thank you guys so very much. And hopefully this was informative for you.
Thank you, Jennifer, and thank you to all of our speakers today. Very inspiring. I have a few questions, but Karan, I'm going to turn it over to you to moderate our Q&A this afternoon.
Sure. Thank you, Megan. Feel free to come off mute and ask your question. If you're in a position where you cannot, we will read it from the chat for you, but we would love to have you come off mute and just ask your questions directly to our wonderful panel. And I should note, I was a former Meals on Wheels volunteer in grad school. So I always think about that engagement piece when you're driving around and you would interact with older adults. This is before the focus became on checking the actual social engagement as well, but it was always a social engagement endeavor. We just didn't call it that back then, but I enjoyed when I had time to do that. But well, let's see, Megan, if you want to kick us off with questions, maybe people will start to think of some things they want to ask.
Sure, thanks, Karan. So, and this question is for you, Uche. So you mentioned wellness checks as part of the additional services and kind of oversight of older adults. So I'm wondering how routine those wellness checks are, and were there more? Did that happen more during COVID, or was COVID a catalyst for that? And is that continuing? And finally, are there particular wellness check tools that you all use?
Certainly. Thank you for your question. Yes, well, the wellness check has always been a part of the service. We are celebrating the 50th anniversary of the Older Americans Act nutrition program, which is the legislation that has resulted and provides that federal support for the senior nutrition program, Meals on Wheels, congregate meals, also known as we know it. So yes, this is 50 years strong of providing meals, providing that wellness check, providing that social interaction, like Karan said. Maybe these are the fancy words that we call it these days, but these are always been a part of what folks with a heart for service have known to do. There are different tools that folks do use in different areas based on their clientele and what they identify the needs to be. There are some evaluation tools that can help document in a home what the hazards might be. But oftentimes it is just the volunteer being wanting to be respectful of the space of the senior, providing that quick glance around, assessing who's in the home, not in the home, identifying dynamics that might be on nonverbals that are also communicated by the senior. So there's a lot that one can take in, even in that interaction by the door. Some seniors are excited to have you come in, bring the food onto the table, put it in the fridge, help with changing a light bulb, or other service needs that folks might have. And sometimes seniors just are interested in interacting at the door. So oftentimes that isn't always the chance to deploy a formal tool, but that initial check can really contain a lot of information that's relayed back to the senior, the Meals on Wheels program. And then if there's a need for greater intervention, those resources are deployed at another time.
Okay, great. That was going to be my next question. What happens with that information once it's captured?
We have an application now that many programs are using that is able to use an app to document really quickly. I see this, I see that, I've taken a note of this, and that information, of course, is documented, relayed back to the program, and then the appropriate solution or remedies are deployed.
Great, that's really, really helpful. So Alex, this is a question. Oh, wait, before I totally take over, let's see if there are others who may have questions.
No questions currently, unless someone wants to come off mute, but I do see a shout out in the chat about pets being included in the mission. And as a pet lover, I can definitely agree and concur. There are lots of times challenges with having to place pets because older adults don't have the resources to take care of their pets, even though they don't want to. But yeah, I agree. It's definitely a great part of the mission as well. Well, Megan, I think you can continue with your questions.
Okay, I will. This one's for Alex. Alex, you talked about the lack of access, not access, but the lack of leveraging the SNAP resources among older adults, and yet so you have eligibility, but then you don't have as many older adults taking advantage of their eligibility. So public health departments can help to promote SNAP resources. So I'm wondering if you have like available messaging or something that public health practitioners can upload to their website or can link to, like how can we use this public health workforce to increase the use of the SNAP resources?
Yeah, thanks for that great question. I have some ideas, but I'd also love to hear from the participants on this call. I mean, I think one piece is that there are specific obstacles that older adults face in accessing SNAP. So a big piece of it is providing accurate information and messaging to address those misconceptions. So, we have a lot of research on how older adults are more likely to feel shame and embarrassment in applying for benefits. So having messaging about how, you've paid taxes, it's time to go to the government to provide help. Important health messages are, we work with a lot of healthcare providers, and using SNAP as, in the same way you would prescribe medicine. Like, it's really important that you have sufficient resources so that you can buy the food you need. And SNAP is one way that can help. So really encouraging them to apply from a health perspective. We're going to be releasing an online course, which is designed for health providers. So it would be great for public health agencies to, offer incentives for employees to take the training, because the training has all kinds of important messages and resources to connect older adults to SNAP and other programs, alongside with the research on, how food insecurity has such negative health ramifications. Mm-hmm. But I'm wondering if folks are already doing things, at the systems level, helping people apply for Medicaid or SSI and SNAP at the same time is really important.
Yeah. Jen, so this might be a question for Jennifer also. Jennifer, I'm wondering how what Walton does to increase the uptake of SNAP resources.
Yeah, so definitely, we work closely with our WIC department for our younger, population, for our moms and our children to, promote our SNAP benefits there. But then, like I said, also we have the vouchers that are passed out through Council on Aging. And so that is something that, we work with Council on Aging in our senior centers to make sure that they are aware that that's an opportunity for them and that they can use those benefits. Pretty much all of our providers are aware of SNAP and, promote either mouth to mouth, or we have literature that we hand out as well. We have some people here that also help with assistance. If we have somebody identified that comes in that, maybe they say, okay, well, I am struggling to pay the bills or buy the groceries or whatever it is, we are able to connect them with some of our community partners through our CHIP program. And then also, as resources that we have through the AFPHS, and get them in, with what they need.
Great, thank you.
Yeah.
I do have a question in chat, and this is from Artist Reed. And I'm assuming this question is for Jennifer, but I'm going to give it to everyone. How are your operations preparing for the inflation/recession with budget and access to food in these coming months? And then there's a comment about, as a clinician, I remind providers that you can't improve blood sugar, blood pressure, body weight if the client is food insecure. That's very, very true. You have to look at the social determinants of health and needs to provide support before you can see an improvement in clinical measures. I think everyone's just agreeing with the statement, but I think the current question is going to, Go ahead.
So, I know that, again, going back to our community partners and the resources that we have, we really rely heavily on some of our partners. We have some great folks here that one organization called the Matrix, they do some wonderful things to help some of our community members with the cost of housing, cost of utilities, cost of groceries, things like that. So we try to rely heavily on some of those partners that help us with offsetting. But again, going back to some of that education, that's key. So, the SNAP education that we do, and even if they don't have SNAP benefits per se, it's still good information and education that can help them with planning and shopping and stretching the dollars that they do have to make healthy choices. Because it's one thing, to go in and, you look at everything on the shelf and you're buying, boxes of Pop-Tarts, this, that, everything else, but that's not necessarily the healthiest option. So we want them, using their money wisely and making some good choices when they go into the store so that they can improve those blood sugars and blood pressure and the weight.
And
Thank
just
you.
in response,
Go ahead.
sorry,
Go ahead,
in
Alex.
response to Artis's question about preparing for inflation, I mean, that is obviously a huge concern for people who are already struggling to put food on the table. So part of what FRAC is doing is, making sure we're maximizing some of the COVID-19 responses that prove so important and that they're extended. For families, we're pushing hard to try and get school meals for all to be free, and for waivers for school meals to continue. They're supposed to expire June 30th. So, not only are families going to be hit when they have to pay for meals when they're used to getting meals for free for the past 2 years, but also the school systems need the enhanced reimbursements. There's still all kinds of supply chain issues, and also the price of food has been increasing. There are a lot of other things besides the food programs that need to be addressed to help with the inflation. I mean, the food programs can only do so much. So I think extending some of the child tax credits and other government's responses to help people during an inflationary period is critical. Just also wanted to let folks know that one of the opportunities to really provide feedback and ideas on how to address food insecurity is in preparation for a White House conference that's coming up in September on hunger, nutrition, and health. And I'm going to put in the chat some information. There's an online portal where the White House is requesting for people to share their stories about struggles with food insecurity and ideas and stories to address it. So it's really important that people populate this website, and we hear from a vast array of people as to their ideas to address food insecurity. So I'll put that in case you don't have it. I'm also happy for folks to connect with FRAC or afterwards, and we can share you more opportunities.
Thanks so much for that big plug, Alex. Just want to put a last plug for folks around the White House conference. The last conference on nutrition was in 1969. So this is a once in a century opportunity to bear in. So thank you so much, Alex, for putting that information forward. And thanks to folks for lifting this up in your networks and participating by sharing your ideas and lifting up the voices of those with lived experience, because this is truly a once in a century opportunity and we don't want to miss it. Thank you all.
Yes.
Thank you, everyone, for all of the wealth of information and resources. We are slightly over time, and I want to, again, thank our absolutely wonderful panel for their expertise and their wisdom and all the information that they've shared. I briefly want to wrap up by sharing that our next training will be on July 21st at 3 p.m. It will focus on data and understanding, again, uses of data and relationship to social determinants of health. And if you are viewing this training as a YouTube recording, please click on the link in the right-hand corner, or please pause the video at this point to take our survey to indicate that you've attended this training if you are interested in becoming an age-friendly public health systems champion, and use this training to account for your attendance. And with that, we'll thank everyone for joining us today, and have a wonderful afternoon.
Thank
Thanks
you.
for
Bye,
inviting
everybody.
us.
Thanks, everyone.